My name's Carissa Johnson, and this is a head, neck, and face assessment.
So I like to go least physical to most physical, which means that I start out with the observation, which I look at the size, shape, and color of the patient's head. So her shape is very round, the size is very proportionate to the body. And then this is her normal natural skin tone, but what you're looking for is any flushing, bruising, petechiae, which she has a little petechiae, a little rosacea, and then any freckles. Generally, freckles will appear along the cheek lines. Next, you're going to look at the symmetry of the face. So you look at eyebrows, eyes, and then these little folds between the nose and the mouth. And you look at them when they're at rest and when they are smiling. So go ahead and smile. Everything looks up evenly on this patient, so we're fine. Next, we're going to look at the glands. We're going to look at the parotid, the salivary, and the thyroid. So you're going to look and see if there's any swelling. Parotid is along the cheek lines. Salivary is right under here. And then your thyroid, you'll note swelling down at the base of her neck. So you want to take note of any abnormalities, mark them down. This patient has a scar on her forehead. So you are going to measure it, always measure it from the widest point to the smallest. So her widest point is 6 centimeters by 4.5. And then we're going to look at range of motion. So we're going to have her turn her head side to side. We're going to look up and down. And then we're also going to tilt to each side. And you're looking for any tenderness or pain. Any tenderness or pain when you do that?
A little tenderness along the right side when I'm stretching it down.
Okay. That can be just from a muscle that needs to be worked out. So then next, we're going to look at cranial nerve 11. Cranial nerve 11, you will place your hands on their shoulders and have them shrug up. Okay. And then you're going to have them turn into your hand. Okay. Turn. Okay. And if they had any issues with that, that would be your cranial nerve 11. She did not, so we're fine. Next, we're going to do all the palpations. So you are going to palpate the scalp, looking for any bumps, bruises, any tenderness or soreness. You're going to note the hair color, thickness, dryness, and then any areas of thinning. While you're palpating, you're also going to feel like suture lines. Make sure all of their lines are closed. In adults, your suture lines are closed. In infants, your suture lines are open. And they can actually even be overlapping because of being squeezed out of a vagina. So then we're going to look at the temporal mandibular joint. So point your head there. It's right back here. You're going to palpate it and have them open and close their mouth. You're feeling for a click or any pain.
No pain.
Okay. She does have a click when she opens it. So probably an x-ray just to make sure that the joint is lining up correctly. It can be done by a dentist, which is probably the best person for that. And then we're going to look at all of the lymph nodes. So we have the pre-auricular right here in front of the ear. Your post-auricular behind the ear. And then you're going to feel on the occipital bone is going to be your occipital lymph node. Your submental is under the chin. And then your submandibular. And then right back here, kind of near that temporal mandibular joint is going to be your tonsillar. And then you have your anterior cervical chain as you go down. Your posterior cervical chain. And then lift your shoulders up for me. You have your supraclavicular, which is right in that hollow that they form when they do that. And then you're also going to feel the carotid arteries. Make sure they're palpating correctly. Should be normal, not weak, not bounding. And then you're also going to palpate the thyroid gland. She has a history of hypothyroidism in the family. So this is something that does need to be done, and it is perfectly even.